I did my practical experience this semester at Kearney County Health Services in Minden, Nebraska. This is a small, multi-purpose facility that is funded as a critical access hospital. A lot of requirements for this practical experience were limited for this facility. That isn't to say that they are not done, but they are not a continual process that is done on a day-to-day basis. So a lot of the information comes from interviewing and observing situations when they were available during the practical experience time frame. A critical access hospital is one that is in a rural area where access to a hospital is 35 miles or further away, more than 15 miles in an area with only secondary roads, or certified as a CAH based on state designation as a necessary provider of health care services to residents in the area. They provide 24-hour emergency care services 7 days a week. Each CAH has a hub facility. The hub facility for Kearney County Health Services is Good Samaritan Hospital in Kearney. The Kearney County Health Services has 4 interrelated facilities under one roof. The Kearney County Hospital, Minden Medical Clinic, and long-term care units share a health information management department along with other areas of administration. The HINT or long assisted living portion of the facility is processed as an independent entity. Hospital services at KCHS include 24/7 emergency room services, outpatient services including outpatient surgeries and procedures such as eye surgery, colonoscopies, and endoscopies. Also included are skilled swing beds used for rehabilitation services for those who need hospital care while recovering from procedures or illnesses which have left them in a weakened state, requiring special therapies before they can move to a more independent living. The medical clinic services provide entire family care. This includes pediatrics, adult, and preventative health care, obstetric services for up to 38 weeks when the patient care is then transferred to another physician for delivery. There are also on-site laboratory and diagnostic services. The average daily census is low, approximately 1.15 patients per day. However, they treated 581 patients in the ER last year and had almost 5,000 outpatient visits in the last year. Kearney County Health Services provides many additional areas of service to their patients. Outside providers in various specialties come to the facility to care for their patients in a convenient place for the patients. Specialty physicians considered consultations for billing and admission purposes include cardiology, dental and oral surgery, eye surgeries, orthopedics, urology, podiatry, and pulmonary. Services such as MRIs and cardiology stress tests are done on a weekly to monthly basis. There are also some outpatient surgeries performed by the in-house physicians, such as colonoscopies and endoscopies. Kearney County Health Services is organized differently than some hospital and clinic organizations. This is partially due to the fact that it is county-owned. The basis of the facility is that we all work together, and you can tell from the structure of the organization and the openness with which it's run. It is an extremely friendly, family-oriented facility. The departments and directors that I worked with in this experience included Rebecca Messman, CFO RHIA, who oversees business and health information departments that regulate such things as records, transcription, and billing, as well as the financial aspects of the entire facility. Amanda Warburton, Director of Social Services, who works with Mary Bunger, Director of Nursing for Utilization Review. Connie Jorgensen, LPN, takes care of the facility quality management, and Rebecca Cook, who is the Director of Human Resources and Payroll. I also worked with Kayla Reynolds in regards to statistics and Sheila Anderson, RHIT, in respect to the coding and medical records management. Neither are department directors, but are specialists in their areas of the facility. The KCHS Health Information Department is organized differently from other HIM departments. Rebecca Messman, Hospital CFO, has her her RHIA and is overseer of the HIM department. Sheila Anderson, RHIT, is in charge of all the HIM type processing, including both coding for medical and clinical encounters, release of information, and other HIM duties as they arrive. Denise is the HIM department clerk, analyst, and record assembler. Melissa and Robin are the department transcriptionists. KCHS has a limited number of reports that it does. Birth certificates are not part of the process at this facility because we do not deliver babies. Most of the reports are computerized, though Robin does make up paper backups of pathology, inactive and purged records, head and spine reports. The death certificates are actually done in a separate area of the facility and not included in the HIM department. Most reports are permanently kept and are turned in to the state once a year. Kayla Reynolds is Kearney County Health Services Accounts Receivable Charge Input Person for the facility. She does the statistics for the facility as well. She has developed several of the reports herself for collecting the hospital information and keeps them up to date on a monthly basis. Two of the main reports that Kayla has developed through the Excel program for the facility are the Practitioner Productivity Report and the Length of Stay Report. The daily statistical reports are handwritten the day the encounters happen and then delivered to Kayla the day after the encounters occurred. One of the main reports that Kayla has to submit is the Nebraska Department of Health and Human Services Division of Public Health Hospital Statistical Report. This is filled in as Kayla does the rest of the statistical reports for the facility and is fairly simple, but it is a mandated report. Because KCHS is a critical access hospital, not all of the sections are filled in, as this is the general form for all hospitals in the state of Nebraska and is required from all hospitals. The sections that pertain to KCHS include the inpatient discharges from services, discharge days, census days, and bed setup, and staffed for acute care and swing bed. Those not filled in this section include OB, NICU, newborn, behavioral health, CDU, LTC, rehab, and LT. There are breakdowns in this section for adults and children. KCHS also fills in the inpatient, including swing and long-term discharges and discharge days from the ages of 0 to 17, 18 to 64, 65 to 74, and those 75 plus. There's another section for long-term and swing bed patients with the age divisions of 0 to 64 years, 65 to 74, 75 to 84 years, and 86 plus. There's an outpatient section broken down into emergency visits and non-emergency visits to the emergency room and clinic, and other outpatient visits. These are for laboratory and radiology visits. There is also filled in a section for the outpatient observations, which are the facility's T&O admissions. The last section that is included is for surgery. This includes both inpatient and outpatient. However, KCHS only does outpatient surgeries.